Start.
This is a case of thrombosed bile. If you can see, this is a huge mass of hemorrhoid which patient noticed just in one day. Before this, he was not having any swelling, any other issues. Once he, after passing stool, he just started noticing this swelling. Normally, it starts with constipation or straining. Sometimes doing heavy exercise in the gym can precipitate the bleeding in these hemorrhoids, and this becomes a hematoma. But in his case, there is no significant factor, and this bleeding is gradually increasing. He started feeling severe pain. He started feeling dizziness because of this pain. So we planned emergency surgery. Normally, this type of swelling many times starts, and after reaching to a point, because of the pressure, the bleeding stops by itself, and then they start regressing. But in this case, this was continuously increasing in size, and patient had a lot of discomfort. So we had to plan surgery for this. We have to actually evacuate this, and until then he will not become comfortable. We can consider evacuating this type of hematoma or removing this type of hemorrhoid in OPD by just giving a nick and removing whatever the clots are inside. But that's not a good strategy, because when we remove this, there is chance of excessive bleeding. If it is a small clot, by removing those, patient will feel better. But in this case, large clot, we expect there can be active bleeding. So we have to do everything under anesthesia and in a good control, where we can stop whatever bleeding is inside, as well as if we need to remove some part of this hemorrhoid, we can stop the clotting, and simultaneously visualize the other hemorrhoidal masses. If there is possibility of that growing with the size, growing in time, that also we should deal. Thank you.